I don't even know how to count them. There have been too many people, too many.
Dr. Victor Azambuja is talking about the patients he lost to COVID-19. Inside this dedicated facility, there were 2,603 coronavirus deaths last year, and that number includes healthcare workers.
We lost many colleagues, many technicians and nurses as well. We didn't have enough people showing up for work.
In a country that is still scrambling to put together a cohesive response to the pandemic and where the number of new COVID-19 cases continues to rise, Brazilian doctors and nurses faced a particularly difficult task. Like in other parts of the world, at the start of the crisis here, they reported not having enough PPE, medicine, or personnel to cope with the influx of patients. But unlike other countries, here, many had to fight their own fears to save lives while not getting paid.
Some of the staff here worked over 6 months without receiving their salaries.
Dr. Vasconcelos says a convoluted system of outsourcing contracts designed at a federal level to cut costs meant when many doctors and nurses fell ill, they could not afford to stay home.
Many went to work with COVID-19, sick, with mild symptoms, because if they missed that shift, they would not get paid.
Brazil is home to the most severe COVID-19 outbreak in Latin America. And despite the more than 200,000 lives claimed by the pandemic, politics and misinformation mean many here still dismiss the threat of the virus.
Today there were 2 burials already that I saw. There may have been more. People are, I think they don't believe in it, but things are serious and they must take precautions.
Back at the hospital, at least one patient was taken away while we filmed this report. An estimated 8 people die of COVID-19 here every day.
When it gets like this, we just stand in silence because we've run out of resources. I have 20 years of experience in ER and ICU, and it's never been this hard.
Annelise Borges, Rio de Janeiro, Euronews.